Reawaken to your immortal identity and discover life between life's wisdom. Presented by the Michael Newton Institute.
Dr. Atilio Costa Vitali is the Medical Director, Heart Failure Disease Management Program and Medical Director, Arrhythmia Program at the Health Sciences North in Ontario, Canada. He is also a hypnotherapist who beautifully bridges the connection between the medical practice and clinical hypnotherapy. So it's very interesting you are sharing this, Atilio, and I always say that there is never a coincidence. So Paul actually shared a video and it brought back memories of 2016 when we were all in Bon Secours and we were training to become Life Between Lives hypnotherapists. And Paul is also my teacher.
Oh, okay.
So I was just thinking to myself that it's such a beautiful moment that one is doing this kind of precious work and being able to do this for the Institute because I'm representing the Institute in this moment with you. And you're talking about a very special person. He's both our teacher, Paul Orand, and very wonderful. And it was as you said so rightly, we've all been through in our lives certain experiences, which you said that you shut the door on, which the friend in Lisbon didn't. And I think as souls, if we look at it, those were those little knocks that came our way to connect us to our spiritual self. We were a bit caught up in our human existence and our human experiences. And then when these souls come back and they kind of say, hello, you forgot you're supposed to look at other aspects of life, that there's just that much more. And then, yes, the joining of the dots happen, the picture becomes clearer. We see things in a very layered way. And the layers that open up, and I think more so because, as you said, you handle very high risk cases, very serious cases. And as a medical practitioner, when you're perpetually connecting to the spiritual aspect of it in your own space. That takes me to my next point of curiosity is, do you feel that as a doctor, as a cardiac specialist, as a cardiologist, your spiritual awakening, your spiritual growth and evolution, and your knowledge that you're already gaining and have possibly gained in all these experiences that you've been through and going through, does it make your approach to your patients any different?
Oh yes, it does. Absolutely, absolutely. Because you just you see patients not as a personality or as a human being. You just see them as a spiritual being. And I always say that from a spiritual point of view, and this is something that it's not something that I read, but something that happened to me, and then after that I read, and it's real. I think that inside us we have the personality, which is what we show, which is what you see from me right now. But inside me and inside you and inside everything human being, there's something. There's the real you. And I think that real you is when you are able to establish a bridge between your personality and your real self. That's exactly when you're gonna start getting answers, for healing or for whatever it is that's happening in your life, because that soul, that entity inside yourself, is extremely wise. It's extremely powerful. Once you tap into that reality, that level of consciousness, you will be able to heal, period. You will be able, nothing that happens to you will really affect you. Because everything we face with our personality, and our personality is very limited. Our personality, what we show to the world, has a lot of baggage. What lies within yourself is pure spirit. And that's it. So we need to try and find the connection between between your personality and your real self. And I think that hypnosis is a way to do that, is a way to connect to your real self. Of course, there are all these hallucinogenic plants like ayahuasca, for example. No, that is a fantastic. I think that every human being once in a lifetime should do ayahuasca. Everybody.
Yeah. Because it strips you of all the ego mind stuff and literally reveals yourself to you.
Exactly. Yes. I remember my first day with ayahuasca. I was in front of this amazing wise being talking to me, and I was like a little child listening to that being. And then I realized that being was myself, was my inner self that guided me through the whole process, because I was so scared, and then I have all the feelings, the symptoms, the horrible things that happen to your body when you do ayahuasca. But then I had that entity in front of me that was so beautiful, and it was so powerful, and it was telling me, guiding me through the process, and it was beautiful. And then I thought it was a separate entity, but it was me. And then at the end you realize, wow, that was me. I was guiding myself. It was a very interesting.
So to say it, you've actually seen your higher self.
I absolutely did. Absolutely. The first night I did, and I was so confused because I did not know what that entity was. All I could feel was the power that entity was emanating, and the wisdom, and guiding me through the process. And it was lovely. It was fantastic. It was very, very therapeutic, and it was me. Yeah.
And do you feel when you're dealing with your patients, a large part of your own spiritual understanding, which probably makes your gut mind work stronger? There's a very beautiful synergy or synchronicity between your heart mind, your own gut mind, your mental mind, because there's an awakening that you've been through or you're going through constantly. Do you feel you approach your medical practice any differently?
Yes, absolutely. I tried to follow my intuition all the time. And when I have a patient in front of me, I let the patient talk. And after the patient finished his or her story, I always asked myself, what do you think? But not to my personalities, to my inner, that wisdom person that
The
I met.
wise you, the wise you.
The wise me. And I always follow what my inner self tells me, always. For the last, since that ayahuasca experience, things have changed dramatically in the way I see patients. And yes, I follow my intuition all the time, even when I do surgeries, because I also do implant certain type of devices.
I was just going to ask you what surgeries. You just read my mind.
Yeah, so it has to do with electrophysiology, the things that electrophysiologists and arrhythmia specialists do, which is catheter-based type of treatments, or we put devices in patients' body to try and monitor their heart, etc. So it's a minor invasive surgery, but it is considered surgery. Even when I do that, I always follow my intuition. Yeah.
Atilio, I want to know something. I'm very curious about the fact that the organ, the heart, the organ, when it goes through any kind of damage, a lot of times we are told certain damages to the heart are irreparable. And then one turns to complementary healing, where we say everything is possible. Now, you're the one who's bridging both. You believe in the power of the soul, you believe in the possibility of healing that a soul can manifest for the body it's being housed in the incarnation that one is in at that moment. Is it something that you have experienced yourself, seen yourself, where you've applied both the spiritual aspect of healing as well as the medical practice that you're very much responsible for and part of, and you've seen an organ actually showing repair which you're not being able to medically justify? I can't hear you.
Can you hear me?
Yeah, now we can. Can you repeat the last bit, just the answer?
Yeah. So I had, I come to my mind two cases. These were two ladies, and both of them had heart failure, which basically means, that the heart is a pump and it has a function which is to pump blood. And approximately 60% of what comes inside a heart needs to be pumped out. That's the normal pumping function of the heart. So when that drops, then you'll start having symptoms of like shortness of breath, tiredness, fatigue, reduced functional capacity. The legs start to swell and accumulate fluid and fluid in your lungs, and eventually you end up in the hospital. And the only way to fix that is with medications through the vein to make you pee, diarees, and take the fluid out. So that's basically what we call heart failure. And sometimes we have organic reasons why the patient go into failure. For example, coronary artery disease, like blockages in the arteries, etc., the heart, etc. Or sometimes, for example, people do things like, drugs, or they drink a lot of alcohol. Those are very toxic to the heart, and that could put patients in failure. So one of these ladies actually she used to drink a lot of alcohol on a daily basis, and females are much more sensitive to alcohol than men. And after drinking for many, many, many years, she developed heart failure. And she was a very, very spiritual person. Actually, she was one of those spiritual persons that I was able to work with. Because she told me that when she was a child, she had a near-death experience. When she was a teenager, actually, she had a near-death experience, and she had read about the little work that I did actually with Paul here in Canada, and she was very interested in participating. But at that time, we had already finished the recruitment, but we became sort of physician-patient relationship, but on a different level, more spiritual level. And I said to her, the recruitment is over, but I could work with you if you allow me to, and we could explore certain things. So we did a hypnotherapy session, and actually we didn't go into the spiritual world. We didn't do that type of thing. We just went into her life. We just went into what triggered the problem. Why did she go to alcohol? What was the main reason for that? And we did some family constellation treatment as well. And then she eventually found out that her grandfather actually was a survivor from the war, World War II, and he died when he was in his 70s, and he sort of created around him. He had night terrors, and he eventually got post-traumatic stress disorder. So he was a very, very sick man psychologically, but he sort of created around him something to protect him. He became very obese. He became an alcoholic. He used all these external things to protect himself from his experiences. And this is the most interesting thing, because when he died, she was like 3-4 years old. But that energy carried forward. And when we went into hypnosis, she was able to feel what her mother was feeling, what her siblings were feeling. Like, she felt all that energy happening there. And then it was very interesting, because this happened, the grandfather was an alcoholic when he was in his 30s. And that's exactly what happened to her when she was in her 30s, is when she went into alcohol. And so it's sort of the pattern repeated, the story repeated, and she didn't even know why. And that was very therapeutic, because she was able to see all that, and that was very therapeutic, because when she realized that there was a connection, that she didn't have to repeat that pattern, that she was a different human being, that she was not her grandfather, then she was able to heal. and this is the interesting thing, no, because the majority of patients who stop drinking alcohol, of course, the heart will get back to their normal function, I would say 70%, but there's always a 30-40% that they will not go back to normal. But she was able not only to quit drinking, but also to in different other sessions we did with her, she sort of reflected into her life and found other ways to protect herself, which was basically going deep into herself, trying to find the answers without finding external things to protect her. And that's how she healed, and her heart function eventually went back to completely normal, and she's now a healthy, very healthy person. But I think that the healing started when she realized that there was a pattern in her life that she had to break, and that's how she broke it, just by seeing it in front of her. And this is the other thing, because for me there was a question mark: how do you break a pattern? But the way to break it is first you have to be part of it. You have to feel. I think that feelings are very are masters. That's how we learn. That's how we understand life, by feelings. When you feel something, you become that feeling, and then you can come out the other way in a different way. Yeah.
But it's true that the way to liberate yourself, you first have to accept and acknowledge those feelings and emotions. And only then was she able to see the entanglement with her grandfather, her mother, possibly her siblings, and without realizing she was carrying it. It's like a pattern repeating across generations, transgenerational. So the very fact she chose to disconnect or disentangle there, that enables the heart to say, I now have to just look after you. I don't have to look after everybody else's everything. And that's when this disassociation that the heart as an organ is going through, that balance 30% of healing, she was able to gift herself. But she could do it because she did that internal journey again and again to see where she needed to rewire.
Exactly. That's exactly what happened with her. But again, and I think it's feelings. People need to feel.
Yes.
That opens up the door. Yeah. And not be scared.
Yeah, I was just going to say that a lot of times, when we come across clients who are not able to allow themselves, and I use the word allow because it's not that they don't feel, they just don't like to allow themselves to even acknowledge what they're feeling. Yes. And they get kind of caught in these quagmires or these repetitive patterns. And they don't even want to shut their eyes. I'm sure you may have seen, they're absolutely okay to cognitively understand it or intellectually discuss it, but they refuse to go into that realm where, you close your eyes and you go into that inner, that closing eyes isn't something they're comfortable with. So
yes.
So what I tend to do a lot of times is say, fine, don't close your eyes. With your eyes open, shift into this space and just imagine you are at that age and just feel it. Just feel it. So you're kind of using constellation tools, inner child healing tools, a little bit of our regression therapy tools, and then mixing all, creating a cocktail which would possibly work for that person because they just don't want to close their eyes.
Yes,
But the
absolutely.
word gets, but yeah, it's the feeling. So very true. And that brings me to ask you that, with all the consciousness shift that one is going through, more so with the kind of shift the entire globe has gone through and is still going through post-pandemic. How has this experience been for you, Atilio, as an individual, as a human being, and as a medical practitioner? Because you must have seen so much more than I possibly could have.
Yes. So, the pandemic was very, very hard in my case because I've lost a lot of people that I knew, not in Canada, but in South America, in Argentina. I've lost very, very good friends and family, without me being able to go visit the country for, 2.5 years approximately.
Yeah,
So it was a
very big.
yeah. So, during the pandemic, I think that it was very hard. But the way I was able to manage it is, first I had to go to work. So we didn't have the pleasure of working from home. So we had to go to hospital, had to work, and that's how it was. But then when I came back home, and you come back home always to, to a space that, silence, I used that to my advantage, and I started to meditate a lot during that time. And I tried to go very deep into myself, to try to meditate, to try to not try to understand anything, because I just went into silence. And I think, and then after some time, I realized that that's an amazing point. One thing is solitude, the other thing is loneliness. I didn't feel lonely, but that pace of solitude, when you go within yourself, is fantastic, because you feel that you're not alone. You feel that you are with yourself, and you're not alone. You don't, that feeling of loneliness doesn't come in, but only when you realize that you're able to go within, and within you have the power. You have that energy that lies within yourself. So I had many friends who went to, at least 7 people that I know, 2 of them good friends of mine, who went into quite significant depression because of being alone, being lonely. But it's, I guess that's the journey they had to go through. But it was a very tough time. It was a very, very difficult time. Yeah.
And what you just said is so very true. With the borders closing, I think one of the most significant feeling or emotion that all of us have had to face at some point or the other was the feeling of helplessness.
Yeah.
Because, we've lost loved ones, we couldn't be there. The closure that one goes through took a long, I would say it took longer. But what you said is very true. When one has learned to accept, acknowledge, honor one's own self, connect with one's own self, find that relationship or rekindle that relationship with our own self, because as we said, we couldn't go out. So we had one way, which was going in. And when we went in, there's this beautiful person waiting to greet you and talk to you, and you get to know that person. And I think all of us who are in some realm in the world of healing, the world of facilitating, enabling, guiding, mentoring, whatever space that we may be in, all of us, I think, will acknowledge that there is this resonance that by connecting to ourselves, we've come out stronger, we've come out more compassionate, kinder, and there's that much more love that one is able to share, with one and all. There's a certain a feeling of oneness. We keep talking about oneness, but I think we felt it. We genuinely felt it during that phase. And that brings me to my last moment of curiosity, just for this session, of course. Atilio, is there anything that you, as a medical practitioner, who's on that beautiful bridge where you're bridging both complementary healing as well as medical practice, that you would like to share as your guidance or possibly your message for those who are listening to this session?
Yeah. So I think that we are all in a journey, and doesn't matter where we are in the world, we have to accept whatever is in front of us. I think that we have to walk on that path, wherever it's leading us to, the best we can, and with acceptance, and knowing that everything will be okay at the end, without fear, and just from love. I think that the mission that we all human beings have is twofold: is love and service. And once we understand that, we're able to walk and try to connect with our inner self, which is the one that really knows what love and service is, and just trying to understand that that everything will be fine.
How beautiful. I just want to say a huge thank you on behalf of Michael Newton Institute and myself for the time you've shared with us, for all your experiences that you've shared with us, Atilio. And just want to say a huge thank you. And I want to just wish you lots and lots of love and strength and all that beautiful light that you're probably connecting to on a regular daily basis, because you work with beautiful beings who seek you out. And with every heart that you connect to from a medical and a non-medical space. May you continue to just share a lot of light.
Thank you so much. Thank you for having me, Indrani, and was lovely. And these podcasts I think are amazing because they bring all these different experiences to people who need them.
Thank you for once again, really from the bottom of my heart. Thank you so much for doing what you're doing, and also a special thanks because we've both studied with Paul, and I think that itself shows that there is oneness. Yeah, this is another experience that here we are, we're connecting this way. But thank you, and thank you once again.
Thank you. Have a good day. Thank you.
You too. Bye-bye.